AI is going to be able to stem or reduce the number of unnecessary communications that are flowing in the healthcare system and reduce the toil of all clinicians. There is no reason why AI shouldn't be in the communication path to reduce toil and effort required to accomplish communications.
How has PerfectServe embraced AI in 2025?
Our journey with AI started a long time ago with our scheduling platform. We're one of the market leaders in provider scheduling. What we do is we take requests from providers, like preferences for days off, PTO, ideal shifts. Like some providers need to get their kids to daycare early in the morning, like I did this morning. Then the organization has needs. They need to see a certain patient throughput, certain level of patient appointments. They have revenue goals and targets. We use machine learning algorithms to create fair and balanced schedules and then have the organization manage those. We've been one of the original companies in our space that's been working with machine learning algorithms. That's where we started. 2025 was a tremendous year for the advancement of using AI in the critical path of these communications that we've been supporting at PerfectServe for many years. Where we started in 2025 with AI, we had our scheduling before that, but in 2025, we released AI to be able to take a phone call from another clinician or a patient and summarize that call really accurately. The reason why the summary was important was it reduces the time needed to read through or listen to voicemails. Over the last 6 months, it often will work much more accurately than a human transcription. All the healthcare systems are now using AI scribes in patient encounters to put documentation updates into the EHR. We're using the same technology now, but to take phone calls and summarize them accurately, both for the record, but also for call disposition and determining what to do next. That's where we've gotten to, and it's just a leap off point. 2 years ago, if you were trying to use these large language models, hallucinations could happen up to 30% of the time. There's a lot of bias in the models, confirmation bias, like the AI wanted to please you. If you're going to introduce that into a patient care scenario, you've got patient safety and accuracy considerations. 2 years ago, if you ask the model something, it takes a minute to come back to you. That introduced a lot of latency. So it's a very unnatural kind of experience to try and talk to AI over the voice channel. They've figured out ways to reduce the hallucinations, if you do it properly, to a fraction of a percent, which makes it much safer for care delivery models. They've addressed the security and privacy issues. So a healthcare system can now make sure their data is protected.
What do you think is coming over the next, let's say, 12 months?
A big thing that happened in the industry this year is the autonomy of the models to do things, complete tasks. So rather than ask a model a question, get an answer, the industry really shifted towards agentic AI, introducing the concept of giving these models two things. You give the model agency, so you empower it to do things on your behalf or on the organization's behalf, and tools. The tools, as it translates in a software company like ours, are APIs where it can do things. So instead of just taking notes and transcribing calls, there's an opportunity now for us to put the agent on the front end of the call to help make better decisions. The caller could be a patient, another healthcare provider, but ask that caller the right questions to disposition the call and figure out where it should go. In a traditional telephone system, if you're buying stuff on Amazon, you end up in a call center somewhere, and there's a lot of button pressing going on still, but you can eliminate that. The reason why that's important in healthcare is twofold, right? Reducing the amount of time that people need to spend on the phone to get resolution, but also the accuracy of where you're sending phone calls. PerfectServe, a big part of our value proposition, is sending the caller the message to the right person at the right time using our routing. We've actually trained AI on our rules of how things should be routed. And then we've given AI agency and tools to be able to actually route and message and do things. It's created a much more responsive and personalized experience. The other set of tools we're giving the AI is access to the EHR. So if you can imagine as a patient and you're calling into a healthcare system or a practice and you need to figure out what's going on with your appointment, you can start interacting with the agent that can then look up your appointment details, make you an appointment, change an appointment, give you test results, start a workflow in PerfectServe to refill your prescriptions. all things that we've actually proven out in our labs. And we're in conversation with several customers of how we deploy that into their health systems in 2026.
Understandably, there's concern in healthcare. Would you put AI into a process that, like you said, hallucinations can happen, but the stakes are higher with healthcare? The future looks a lot more like properly trained AI models that can make processes more efficient, which is going to help everybody.
Yeah, you're right. So there's two aspects by which what we're doing at PerfectServe is unique to the way we use a large language model. The first thing we need to do is train it based on the rules of the road or the communication rules that our customers have been using for years. Hey, after 5 o'clock, this provider shouldn't get a text message. It needs to go to the on-call, right? AI needs to learn how to do that. It needs to learn how that rule works, and it needs to learn how to use the tools to send that message to the on-call. So that's one aspect of how we train the AI. The other one is the guardrails. The foundational companies like OpenAI, Gemini, Google, they've got guardrails already, like generic guardrails. In fact, OpenAI just released a huge announcement that they're going to prevent ChatGPT from giving legal advice or medical advice to users, as an example. So that's a guardrail they installed. Likewise, we have our own guardrails that we need to install. So for example, if a patient calls and they start asking for opinions on where they should go in a health system, like you need to guardrail that. The healthcare system's policy is supported by the model. But just over the past 6 months, we can do things now conversationally with AI over the web and over the phone call channel that you wouldn't have been able to do 6 months ago, just based on how much better these models are and how quick they are to respond in like synchronous phone call communication with a patient or other healthcare provider.
So right now, if you could snap your fingers and have AI fix anything in the ecosystem where we operate, what would it be? And is that a tangible thing?
So I've talked a lot about that interface to patients and callers, but a big part of our mission at PerfectServe is speed to care. That impacts obviously patients. So getting treatments faster to patients, reducing the amount of time it takes patients to get resolution. The other critical part of that mission of ours of speed to care is how we support our providers. Today, if you're a provider and you're in a healthcare system having to interact with all these different technologies, AI Scribes has revolutionized the way they document into the EHR. And that's great. But there's no reason why AI shouldn't be in the communication path to reduce toil and effort required to accomplish communications. Where I know we can go next, the technology's almost there, is the ability to insert, if you will, a co-pilot or an agent into our actual internal clinician-to-clinician workflows. Whether that be how you access or change a schedule, need to get information about your upcoming shifts, need to hand off a shift, like I have an urgent situation in my family, I need coverage now. How could AI help resolve that situation for a provider and not just reduce toil, but actually add delight at how magical it seems now that they're working with a responsive system that can just mold to their needs in real time. Communications are another example. I was talking to a health system where they have a huge point of frustration amongst their clinicians with how referrals are done. So if you're a referring provider, there's a bunch of forms and then those get shot over. There's healthcare systems where they have an ecosystem of different EHRs, and the interface between them, I've seen it myself, as a fax that gets sent back and forth. Faxes are obviously falling by the wayside, but the workflow that was introduced is not. So a lot of referrals now, it's like, fill out a form, someone gets a PDF, they review it, they're like, oh, that's missing some things for a referral. I'm going to reject that referral. I send it back. It goes into a provider's EHR inbox. It doesn't get seen for a couple days. Oh, actually, no, I missed this other thing. You look at something like agentic AI that can say conversationally, hey, Matt, this looks like a referral to a GI specialist. The GI specialist needs to know these things before that referral can go in. So you complete that referral with 100% accuracy at the point of referral. And then on the other side, the provider doesn't necessarily need to weed through a complex document. They can just have a very natural conversation with an agent. So you take that concept for nurses in their world, there's a huge opportunity to use AI to revolutionize how an SBAR gets done. Verbal and telephone orders are a big deal across our customer base. So you can imagine AI to make those communications just frictionless. As we train the AI on how our routing works, AI is going to be able to stem or reduce the number of unnecessary communications that are flowing in a healthcare system and reduce the toil of all clinicians.
I think when you use the word magic, the way I think about it would be that some of the toil that you're talking about, people have just come to expect that as part of their jobs. It's just baked into the industry and how these workflows happen. To have a tool that can make them magically disappear, it seems like a small thing on the surface, but these things happen a lot every day. People are going to be very excited to find these more frictionless interactions, which ultimately, to your point, is in service of speed to care.
Yeah, there's third-party studies, and we've done a bit of our own research to figure out, well, how much time does a provider spend just trying to coordinate and communicate? Not visit patients and have stuff documented to the EHR, but just all the follow-up around moving patients through. Depending on the role, that can be 30 to 40% of a clinician's time. So AI scribes in the EHR can knock out 25, 30, maybe 40% of the time. But what about AI for all those other non-EHR related tasks and coordination?
Totally. To put a little bit of a finer point on it, we surveyed 350 clinicians, and we found, based on their feedback, that 87% of these folks that we surveyed experience daily communication breakdowns while providing care. That's the runway that I see for AI, is fixing some of these endemic problems with care coordination and the way these people communicate with each other.
Yeah, 100%. There's some interesting discussions about fear of AI replacing jobs. But the reality is, what the data shows, when you introduce a technology like this that increases the supply of something, the demand also increases. I think it's Javon's paradox. If we were, for example, able to deploy PerfectServe into a healthcare system that's giving 30% of a provider's time back, that means there's 30% more demand opportunity to deliver more care and more revenue. So it's not a question about jobs. It's a question actually about productivity. You have two ways to look at this, right? The pessimist way says, oh no, all the jobs. The optimist way says it's the age of abundance. I think the reality is it's actually in the middle of that. We're going to eliminate the unnecessary work, free up resources to give more capacity to the healthcare system. More capacity means the ability to handle more patients more quickly. So right now, if you're a patient calling in, why should a patient be waiting 3.5 minutes to talk to a clinician? Use AI to help disposition and triage that call, get it to the right place faster. And you can now have one nurse doing the work of 3 nurses, addressing the nurse shortage. And the same is with providers as well. If you can make them more productive, history shows that as soon as you unleash that availability and capacity, there's a market for it and it gets consumed. I don't think there's any place that's more true than in healthcare. Demand right now is far outstripping supply.
It's making me think then, Ben, that maybe the way people are conceiving of healthcare delivery is still very much driven by a world where AI didn't exist as much. And so we don't even really know 5 years from now what it's going to look like.
That's right. The whole operational model is going to change. So it's not just a matter of, hey, we're going to save time documenting stuff in the EHR. It's what is an EHR and who actually uses the EHR. The whole operational model will change. And that's true about all communication software companies like PerfectServe. And I've actually seen this where introducing a concept on AI starts a conversation with a customer where you're all of a sudden discovering new jobs to be done with that AI and new ways of doing things that basically displace the old way of doing things. It's going to take a long time, but we're already starting to see some really interesting returns on that investment. Communication, triaging, operational efficiency, I think that's going to be really a big theme of 26 and 27. I would say 27, 28 is where we see these co-pilots changing the fundamental way that you're doing communications altogether.